Hi, and welcome to another Waterbury Hospital podcast. Today, I'm joined by Dionne Quenah from the Waterbury Bridge to Success program and our own Lauren Fruehan, who's a lactation consultant right here at Waterbury Hospital. And we're going to talk today about the CHAMPS program, which is a program that's been going on for about a year here at Waterbury Hospital. We're one of 100 hospitals in the United States that participate in it, and it's all about maternal health and healthy babies. So, Lauren, I'm going to let you take it over and tell me about the CHAMPS program and what it means to our mothers, our new mothers here at Waterbury Hospital.
Yeah, so the CHAMPS program is a national program now. It actually started as a pilot program in Mississippi, and the purpose was to basically bring about the 10 steps to baby friendly, which is a national initiative as well, actually a worldwide initiative, to help improve breastfeeding rates among moms and babies, which is proven to help both the health of the mom and the baby across time even. So in about February of last year, they were looking for hospitals across the nation to help with these steps to kind of put it into an initiative. And they wanted from all over the country, and we just happened to be the one in Connecticut that got to be it. So we're the only one in Connecticut doing this. And what they do with us is they help by providing trainings to us. We have a coach that we meet with both one-on-one as the person who's leading it, as well as with a group of employees and community people like Dionne to kind of figure out what we can do next to improve. And then the third part of it is we do a lot of data collection.
Right.
So we're collecting information on whether breastfeeding was initiated at all, so that means any breast milk at all, and then exclusivity, so that means if they leave only having breast milk. And then we also are collecting rooming in, so do they stay with their mom 24/7, as well as is baby going skin to skin right after birth for at least an hour or until the first breastfeeding is done, whichever takes longer. And then it's stratified by race, because what they found in Mississippi was there was quite the disparity between mothers who are white and mothers who are black or brown when it comes to breastfeeding. And
this is, when you say disparity, there was a higher level of white folks that were doing it and less in the black and brown community. And we're trying to correct that.
Bring it closer together. And in Mississippi, they had no baby-friendly hospitals at all. And by the end of their program there, they actually have like 11 or 12 now, which is really great. And they saw those like disparities come much closer together in all of the 4 things that we're tracking.
And so, why was it that this was important? Why is a baby-friendly hospital important? Tell me about what a baby-friendly hospital is and why that's important for babies.
Oh, it's a great thing. So baby-friendly was something that was started by the World Health Organization and UNICEF. And each country has their own body that basically certifies it. So it's a certification you can actually get as a hospital. And there's 10 steps to it, which runs everything from what our policies say, how we obtain formula, to skin-to-skin contact, to the training our nurses receive. There's minimum requirements for each of those things. And they have so much research on the outcomes from this and how it leads to longer breastfeeding, to healthier babies, healthier moms with less complications post-birth, and really just so much more bonding and connection, so psychosocial side effects too from it, which is really amazing stuff. And it really helps also bring the hospital in with the community. So one of the steps requires us to have like those community connections, which is what Bridge to Success does with us.
Which brings me to Dionne, who is the public health consultant with Waterbury Bridge to Success. And what is your role in this, and how do you interact with Lauren and staff?
Yeah, so we're a local nonprofit here that about 3 years ago we started focusing on Black maternal health. So we bring the community together around this initiative to increase awareness about the disparities that we experience in birth and in the postpartum period. So this initiative was, I think, very near and dear to us as well, because it brings us to the table and it brings the voices of the community to the table. So one thing we're doing right now is, in the future, we'll be partnering on a lactation survey. We're going to gather information on the barriers that residents perceive around breastfeeding, and we'll take some action based on that information that we find. So currently we have a couple of initiatives going, but one of them is a doula access initiative. So we have partnered with an organization called Earth's Natural Touch that trains doulas to provide information and support to people who are giving birth or in the postpartum period.
And for those who don't know what a doula is, can you explain what a doula is and why they're important?
Yeah, so a doula is a non-medical trained professional that provides informational, emotional, and just the physical support when you're throughout the pregnancy, really, during the pregnancy, at birth, and in the postpartum period to help support you with processing and also to make sure that you have the most optimal outcome from birthing, because it's a very precious time, but it can be traumatic. So having the support to help you process and your body itself go through the process, and so that you're not second guessing yourself and
Right.
you know that you have someone to support you is essential. So that's where doulas come into play.
And you also talked about advocacy too. I
Yes.
mean, the doula advocates for the mom too.
They definitely do. So especially they sometimes accompany moms to doctor's appointments so they can be that voice, or they could just be there listening for information that maybe the mom might have forgotten, or even questions that they forget to ask at the appointment. And then during the actual birth, sometimes a mom can have a birthing plan and she wants to stick to that plan. Having the doula in the room could help her get as close to that plan as possible by partnering with the doctor. So they're definitely that voice for the patient throughout the pregnancy.
Pregnancy, at childbirth, after childbirth.
Yes.
For as long as the mom feels that she needs that doula.
Right, and there's exactly, and there's data to support that. And since we're talking about breastfeeding, when it comes to CHAMPS, people who utilize doulas are more likely to initiate and maintain breastfeeding after they leave the hospital. So that's where I think the connection is as well. They work really well with their lactation support persons when they're in the hospital, but the smooth handoff happens when you go home and you have a doula to help you.
And that's important because what we're trying to do is create, like a holistic approach to baby health, mom health, family health, really.
Exactly.
Right? And so tell me about, you were talking, you had a few things that you said that were interesting to me. Skin to skin contact. What does that mean? Why is that important? What does that mean?
It's a great question because it's one we get all the time. Why would it matter that the baby goes skin to skin right after birth? So true skin to skin means that once baby comes out, as long as there is nothing wrong with the baby and nothing going on with mom, the baby goes directly on mom's abdomen with no clothing or anything in between them. And the baby actually can get to the breast itself if left alone, which is hard to do because everybody wants to get in there and help the baby.
Right.
But it also does so much more. It helps to regulate the baby's breathing, heart rate, glucose, to really help that transition period when babies often have a little bit of a struggle. It also helps with thermoregulation. So when babies are first born, they have to adjust to being on the outside. And they've done so much great research, even using infrared, to see how mom's body heats up to actually keep baby's temperature perfect.
Really?
It's fascinating. And then there's also the microbiome of the body. So it's actually seeding the baby's body from those first times on mom. And then for mom, being skin to skin helps to release all of those great hormones that create that connection, which are also the hormones involved in lactation. So it kind of gets things going on the right start. And we know when babies and moms are separated, that it's kind of the opposite effect.
Yeah.
They kind of go into that fight or flight response.
Do you feel like modern medicine, as we've evolved, we've moved away, or inadvertently moved away from Mother Nature, and now we're kind of moving back to Mother Nature a little bit?
A little bit.
Because we've been having babies for probably over 100 years now.
Centuries.
Right? I mean, obviously,
Centuries.
right?
Centuries.
So before there was doctors, there was babies, right? And so, and I think that's important. So tell me the CHAMPS program and Waterbury Bridge to Success. We've been at it for almost a year now. Where are we? What do you think? How do you think we're doing?
We are actually doing pretty good. So our breastfeeding rates overall have increased. We do see the monthly fluctuation because there's sometimes things beyond our control. If we have more moms who don't want to breastfeed at all,
Yeah.
we can't control that because
Yeah.
mom's choice is still on the table. We don't
Right.
take that away. But overall, the trend is higher. We do have some work on the disparities portion of it. We're not too different than the rest of the country in that area because it's a national problem, these disparities. But we're working on different initiatives to help with that. We're in the beginning stages of the training that's required of the staff, so
Right.
they're going to be getting 20 hours basically worth of education on all aspects from counseling to hands-on skills to the benefits of breastfeeding, skin to skin, all of that.
All those things.
Even medication and breastfeeding, because that's often a barrier for moms.
And what are some of the barriers? Is it social? People they don't know about the benefits, or they've had a bad experience in the what are the barriers that we need to overcome?
There are
Definitely those,
quite
I
a
was gonna
lot.
say.
Yeah, I talked about the survey that we're doing together, and we get a lot of mixed messaging. Some people, it's just, I'm going back to work, and so they come up with a plan to wean, or sometimes they choose from the get-go not to initiate breastfeeding because they're worried about going back to work.
Sure.
So we're learning quite a lot about what people's real concerns are. I mean, there are people who, for whatever reason, sometimes the milk doesn't come in. It's there, but it doesn't get expressed as quickly as it should.
Yeah.
And Lauren has support systems she has resources to help folks like that to eventually initiate breastfeeding on their own. But there are some barriers. Sometimes it's physical, it can be medical, emotional.
Yeah. Do you feel that as a culture, as a society here in Connecticut at least, that we're better at conveying those messages and making mothers feel like it's okay to pump, for instance, at work when they return to work and they want to, things like that? Do you feel that we've gotten there yet?
I think it's a little bit loaded of a question
Okay.
because it really depends on who the mom is.
Yeah.
Overall, the Department of Health in Connecticut is very pro breastfeeding and getting that message out there and trying to do everything they can. Like they have a program for breastfeeding friendly workplaces, which Waterbury Hospital actually is one of them.
Right.
Which means they have a dedicated space for moms to pump and they allow for breaks to pump. But not every place does that, even when it's required by law.
Exactly.
Okay.
So
I was going to say, we pulled that from the survey as well. Some people said their employers don't provide space for them to breastfeed or pump.
Right.
So,
And that could cause a lot of stress. I mean, because you're trying to provide for your family and you're trying to do what's right for your baby, and sometimes those things don't line up.
Right.
yeah, and there's the physical part of it too, is like your body produces when you express. So if you're not expressing, you end up drying up and you can't continue to feed breastfeeding.
So that's like a barrier, but we also know that not every mom's educated on breastfeeding in the prenatal period. Or it's just, what are you going to feed your baby without discussing the risks and benefits of each, which is really important to have that informed discussion with moms when they're in that period of deciding what they want to do.
So what does that look like? What does that consultation look like? How does somebody who is expecting get in touch with you to get the education?
Yeah.
I mean, right, how do they get that? How do we get that to them?
And that's the hard part.
Okay. Yeah.
Because we can say a lot of things, but ultimately, most moms are going to learn at their prenatal appointments where their resources are. And so we can provide that information to offices, but it's really, they have to take that and make that part of their regular practice. We can do our best, like for example, my number is on the hospital website, like you can look it up, and you can call me and I can help you. We have classes here.
Open to anyone.
Open to anyone.
Anyone could go on our website, look at it, and register for a class.
Yep.
And Lauren will be there.
Yes.
And
Most of them.
She works 24/7. And then, Dionne, do
Yes.
people get in touch with you in terms of doulas and getting in touch with an advocate for them?
Yeah, so Waterbury Bridge to Success has a Facebook page. We obviously have a website, so you can reach us at any of those sites. I think, let me see, I think it's waterburybridgetosuccess.org. Don't quote me, but they can definitely Google search
Google
us
it, right.
if you want to find us. We're more of that informational bridge. I mean, we're partnering with Waterbury Hospital.
Sure.
I think this partnership has been really, really great
too.
and instrumental, because when we have community events, Warren comes. So them being able to put a face
Sure.
to the hospital has been helpful. So I think if they want to learn more, they can definitely reach out to us. But we'll be out in the community as well. When we have events, we promote them on our website and on Facebook. So if they're interested in joining us, we welcome everyone in the community to come get information beyond just breastfeeding, right? We're all things maternal health. So if you want to learn anything that you think you need or anything you're lacking, reach out. Let's see if we can help you.
I love that.
Yeah.
So happy and healthy babies and mothers and families. That's what we're
Yes.
interested in here, right?
Definitely.
Lauren and Dionne, I want to thank you for joining me today. This is important stuff here. We're so proud to be part of this CHAMPS program. We're the only hospital in Connecticut, and we're all about making people healthy and happy. And that's what we want. So thank you both for joining,
Thank you
and
for
we'll catch
having me.
you next time.
Bye.